Speaking of sleep, if you're having trouble staying awake or trouble staying asleep, this could be a sign pointing toward a serious sleep disorder, sleep apnea. Dr. Greg Silverman joins us live to discuss this further. Dr. Silverman, what are some of the signs to look out for when it comes to sleep apnea?
Well, generally it has to do with you hear heavy snoring and then episodes of apnea where you don't breathe at all at night. And this is what we hear a lot of times when partners say, boy, he or she really snores very loudly and then just kind of stops breathing. If you have it, you can feel where you don't feel like you've gotten enough sleep the next day. That is very tired, just can't quite go. Where you take naps all the time, or where you wake up in the morning and you still feel tired. Those are symptoms of sleep apnea.
So look for that. Also, your partner telling you, hey, this is what I'm seeing.
Right.
What can lead to this? Is there a genetic predisposition to this, or is this a weight issue?
Well, a lot of times it's a weight issue. Most of the times it's in overweight men, but it can occur any other time. Sometimes there's a different type of sleep apnea called central sleep apnea that can occur in diabetics, in hypertensives. There are other causes of this. All the symptoms, however, are similar. They kind of meet at a similar symptom.
So what are some of the treatment options that we have here? Do we have to go take a sleep test in order to figure out if we have this, or how does that play out?
Yes, if you have a question that you have it, talk to your physician or your provider. They can order either a sleep study, or sometimes there are home sleep studies where you can take it and it will measure whether or not you actually stop breathing in the middle of the night. And if that happens, then yeah, you do have sleep apnea. The treatments are generally what we call positive CPAP or positive pressure airways, where you're actually forcing air into your lungs and keeping your oxygen from decreasing during those episodes where you stop breathing.
Is there a
there are also other, if it's really bad, there's surgeries and different types of ways of changing the back of your throat, changing the physiology of the back of your throat, mostly have to do with surgery.
Really quickly, is this a worst case scenario? You could end up dying from this?
Well, you can. Generally, you don't, but you can get other problems associated with this. Generally, high blood pressure or pulmonary hypertension is one of those. Atrial fibrillation is one of those. It's a questionable diagnosis, but people who have sleep apnea have higher risk of having diabetes and hypertension. So it does lead to problems down the road.
Things to look out for there. Dr. Silverman, as always, we appreciate your insight and input. Thank you, sir. If you have a question, yes, for Dr. Silverman, send us a text at 361-855-6397. We'll do our best to get that answered as quickly as possible.